they say sex hurts and they have no idea why and how to fix it. It's not an aging problem. It's a low estrogen or lack of estrogen problem that we should be able to ask for a product for dry vagina.
I want to take that one and throw it out the patriarchal window.
Whatever beautiful means to you, this time of the month will help you find it and live it. Welcome to This Time of the Month. I'm very excited because today we have a menopause-certified pharmacist, Teresa Isabel Dias, and she has her own menopause consulting service called Menopause Ed. We're going to talk all things vagina health. We'll use some scientific terms because it's important to understand them. Teresa, welcome to the couch.
Thank you. Well, nice to be here.
Yes, we met quite a few months ago and I reached out because it is so hard to find evidence-based information on a very taboo subject. So through menopause, we talk a lot about hot flashes, but vagina health is a little bit uncomfortable. What do you see as the most common complaint of people who come to you?
So most people don't talk about it unless they probe to talk about it. And that's one of the problems. They don't mention it to their doctors and most doctors don't ask them. So they say sex hurts. They're not sure why. They just know that all of a sudden it's uncomfortable. Sometimes it's painful and they start avoiding it. And they have no idea why and how to fix it.
It's so hard. It's definitely a secret subject. So that is part of a broader issue called Genitourinary Syndrome of Menopause. Should we define it, please, for our audience?
Yes. So for an immigrant like me, let's call it GSM because it's a lot easier to say. It is a constellation of symptoms regarding the genitals and the urinary tract. So vaginal dryness, itching, burning are some of the genital symptoms. And then some of the urinary symptoms include having to go to the bathroom very often or very fast. So urinary urgency. There's also dysuria, which is pain when you urinate, and also urinary tract infections. Some women have some of these symptoms. Most don't have all of them. And they are treated differently, but they all are part of what we call the Genitourinary Syndrome of Menopause, GSM.
GSM. So I like to think of it as vagina wellness. We're going to have a little vagina wellness talk. What are the things that we can do if we're feeling any of these symptoms?
So different things. So for example, women find that vaginal dryness is usually one of the first symptoms, and it happens because of decreased estrogen as we go through the menopause transition. It can happen during perimenopause, or it can happen only in postmenopause. So everybody is different. So vaginal dryness is usually the first thing they find. Some women find that it's harder to wear tight pants or riding a bike. So it's not a problem that affects only women who are sexually active. It affects all of us. And when you feel those sensations and you don't know what's going on and you don't ask, you don't know what to do about it, how to improve it. So many of us suffer in silence because, this is happening to me. Maybe it's just the way it is. It's not an aging problem. It's a low estrogen or lack of estrogen problem that can be fixed. And if it's not treated, it only tends to get worse, contrary to hot flashes, which tend to get better with time since menopause.
So what are the things that people can do?
So first-line therapy starts with lubricants during sex and moisturizers regardless. So you use a moisturizer to bring on moisture to the tissues. Lack of estrogen causes the vaginal walls to shrink, and the layers that were there and produce lubrication are gone. So when you are aroused, you don't produce as much lubrication as before. So adding a lubricant during sexual activity increases comfort. But women may also want to have a moisturizer added, and it's usually 2 or 3 times a week as per whatever product you use, to bring moisture to the tissue so they can feel better even when they're not having sexual activity. And then they can also add the lubricant during sexual activity.
It's funny how we just associate our reproductive organs for the sole purpose of pleasuring or giving birth for those who are able to. But there's a lot in between. So thank you for highlighting the just everyday activities and the clothing. That's a real pain point.
I know clients who have gone through 3 different biking shorts because each one of them made them uncomfortable. So they thought it was part of the equipment. The equipment was not right for them. And when I said, did you ever get a diagnosis of vaginal dryness? Because there could be many symptoms that cause many reasons for these symptoms. So it's good to go see the doctor and be diagnosed with GSM, which is a common, 80% of women experience this at some time in life. So we have to make sure that it is the diagnosis and not something else that will be treated differently. But when you've gone through 3 pairs of shorts and you're still riding a bike with much discomfort, there's got to be something else to it. So go to the doctor, make sure this is what's affecting you, and then treat it accordingly.
And so in addition to going to a doctor, you mentioned the lubricants and the moisturizers, which is, again, not to be shy to use those things. It can be embarrassing to go to a pharmacy and pick that up, and then daunting to make a choice. So you want to walk us through your recommendations.
If you've ever been in the female section of the aisle in the drugstore, is just, oh my goodness, what is all this for? What do I do with it? What do I buy? Many women just don't ask the pharmacist because, as you say, it's embarrassing. And many leave with no product or the wrong product. And some don't even know the difference between a lubricant and a moisturizer. So lubricant is to be used during a sexual activity. Moisturizer can be used on a regular daily basis or whatever. When you're looking at a product, you want to make sure that you buy a product that is comfortable, but you don't know that until you experiment. But the first thing you should know is don't buy anything with warming substances, with flavors, because those added on products can cause irritation. And many of the products that are in the market actually are not the best for us to use. So read the labels, try to pick something that has fewer ingredients, no heating, no warming ingredients, no added flavors. Don't buy something with a spermicide because the risk of irritation is also higher with those products. And ask the pharmacist. They should know more about those products than you do. And there's no shame. If we can ask the pharmacist for a product for dry eye or aching ears, we should be able to ask for a product for dry vagina. So we have to change our idea of body parts. Everything is part of us and everything needs attention.
So one of the things that I realized in my perimenopause, menopause journey, and I was deep in some research, is that a lot of the lubricants on the marketplace, I should say water-based lubricants, are not the right pH or the right osmolality. So how would someone, and we should define those things. Okay, so why don't you take the pH and I'll take the osmolality?
So most people are comfortable talking about pH in terms of a swimming pool. They know that the water must be at a certain pH in order to be safe to swim. So our vaginas have an optimal pH as well. It's less than 7. It's a bit acidic, tends to get less acidic with age, and in postmenopause is more. But it's important that you use a vaginal product, a lubricant or a moisturizer that is neither too acidic or not enough acidic. So there's a
range.
There's a range that recommended that you can use. Unfortunately, none of those 2 things is written on the product. So as a pharmacist, I don't know unless I do my research. And as a customer, you don't know because it's not written on the package.
It's really tough. And on the osmolality side of things, basically,
in a very simple way. It's the amount of substance or material in a fluid. And if it's too much osmolality, it will draw water away from your vaginal wall. If it's too low, then your vagina cells want to take in the water and balloon up. So those are not healthy because it just basically damages your skin cells in your vagina and makes it more irritating. What can we do if that information is not available on the label?
So it's tricky. It's very tricky. So I tell my clients that I only have a handful of products that I like to recommend because they have the right pH and the right osmolality. And one of the moisturizers, is kept behind the counter. So it's not a prescription, but you must ask the pharmacist for the product and ask the pharmacist how to use it. Optimally, they will tell you how to use it. It's one ovule, and you insert it 3 or 4 times a week, depending on your need. And it's made of hyaluronic acid, which, as you know, it's an ingredient we have in our body naturally, and it's used in many products for wound healing. It attracts water to the tissue and moisturizes the cells. So that hyaluronic acid, as an ovule, there's also available over the counter in a gel. It's a very good moisturizer to use. When it comes to lubricants, as you said, because I don't know the pH and osmolality of water-based products, I tend to avoid water-based products. And also, they don't last as long as others. The oil-based products are good, but if you must use a condom for protection against sexual transmitted infections, an oil-based lubricant is not a good option. My favorite option, for all the reasons I mentioned, plus extra gliding and long lasting, is a silicone-based lubricant.
And we'll have those links in our information for our audience to find out about. You know, using lubricants is a really touchy subject. Mm-hmm. I don't know if I'm the only one who feels this way, but it's like a failure, right? To have to use an external aid. How do you counsel through your coaching? How do you counsel patients?
As I said, it's nothing you've done wrong. Menopause is not a curse because we didn't behave. It's something that naturally happened to us. We lose our estrogen. And there are lots of estrogen receptors all over the body, from our brain to our skin. And there's lots around the genitals because estrogen is the predominant female hormone, and the genitals in a woman are covered in receptors for estrogen. When estrogen goes, that positive effect on those tissues goes. So as I said, the cells start shrinking. The walls of the vagina start shrinking. The outside also dries up. And if you want to continue feeling comfortable, you need something. If you lose your eyesight, you don't stop reading. You get prescription eyeglasses. So if you lose your estrogen and you get dry genitals, you use products that are going to improve the moisture in the place and increase your pleasure during sexual activity.
So speaking of pleasure, does it help to exercise the vagina to, for our health? And by exercise, I mean on my own.
Oh, yes. Sexual activity on your own with a toy or a partner is one of the treatments for vaginal dryness and GSM. So if it doesn't hurt.
Right.
So if it hurts, you don't want to do it. Makes sense. So if it hurts, as I said, first line therapy, use moisturizer, use lubricant. As you have local activity, it increases the circulation to the spot and increases moisture, and everything works better. So one of the treatments is sexual activity.
So no shame in masturbation.
Shame. No,
it's actually therapeutic.
No, you're not going to hell.
You're not going to hell. So we'll put that in the exercise regime for this for this coming month. Okay, so if it doesn't hurt, you can use toys. What about dilators? I feel like a lot of people do not know about dilators. And I want to give a shout out to our breast cancer and cancer survivors in general, because one of the side effects of that is early menopause, and the idea of sexual health is super taboo there. So what can we do?
So yes, indeed, that's a good point. They are the cohort of women most affected by this problem, usually younger in life, and they are very poorly served by our healthcare because nobody talks about this. So dilators are good. One of the recommendations I make to all of my clients is go see if they can afford it, because unfortunately it's not covered by our it's not covered by our public health. Go see a pelvic floor specialist, so a physiotherapist that has a specialty in pelvic floor, because there could be prolapse, there could be tightness. Sometimes it hurts because it's too tight. Sometimes there's prolapse because the pelvic floor is too lax. Most of us don't know which one is our case until someone looks at it, feels it, and talks to us about it. So go see a pelvic floor specialist. If the painful sex is not due to dryness or any other medical conditions that we already mentioned about, it's due to tightness or to the opening of the vagina closing because of a very tense pelvic floor, or lack of being able to relax during a sexual encounter, or because the opening is shrinking because of whatever else, you can use. Usually I ask them to go see a pelvic floor therapist because you need to know which size vaginal dilator to use first.
Right, you can't just order it on Amazon.
Exactly. There's lots of products, but I don't recommend anyone to do it. So try it out with a therapist, find out what the good size for you is, find out how to use them properly, and then you can do all that at home.
That's great. Now, we talked about, we haven't really talked about hormone therapy. We have discussed it in previous episodes. Do we just want to touch briefly about menopause hormone therapy in relation to GSM?
So as I said, lubricants and moisturizers are the first line therapy.
Yeah.
If those don't work, or they stop working, or they're not working optimally, the next step is low dose vaginal estrogen. So not to be confused with the other estrogen that you talked about in previous TTOM episodes. It's less absorbed because it's a very low dose applied to a very small spot in the body. It's not going to be taken orally or as a patch or a gel and going to go through all your system. It's going to stay mainly in the vaginal tissues.
So what are other products that we can use that don't have even the local intravaginal estrogen as options?
So recently, in the last 3 or 4 years, all the therapies for GSM were approved in Canada finally. They've been in the United States for a long time. We finally approved them. So for women who prefer, these are still hormonal based. There's an oral tablet. Sometimes women are physically not able to apply something vaginally. They may have arthritis. They may have some other disability or inability to use a vaginal product. So there's an oral product now, ospemifene. It's a selective estrogen receptor modulator. It works on the vaginal tissues. It doesn't seem to affect the endometrium, and it doesn't seem to be stimulating for the breast. So it's a perfect thing for just that area. There's also a new product that was developed in Quebec. It has been approved in the United States before it was approved and accepted by Health Canada. And that is Prasterone.
Yeah.
Or some people call it DHEA. I'm not even going to say what it is because I can't say it properly. But it's not to be confused with the DHEA that many women look for on the shelf in health products and in drugstores to take orally. So this is a prescription made with Prasterone, which is the manufacturer, the developers, the experts that came up with this product say it acts solely on the vaginal tissue. So it is a vaginal ovule that is inserted every day, and this progesterone in the area, in the tissues, is going to be transformed, metabolized into estrogen-like things. So because of that, and because we don't know how much hormone comes out of this system, it hasn't been studied in breast cancer survivors.
Okay,
so
so
it's still not approved for breast cancer survivors, but it is another option. Along with the low-dose vaginal estrogen, we have progesterone, ovules, and we have ospemifene tablets. So there's a few options.
There's some good options. I want to touch upon something that I don't know if people are very aware of. I've seen vaginal energy devices such as CO2 laser treatment, basically, for the vagina marketed. Now, what's the deal with that in the evidence? Because it's really not clear the specific indication that it's used for versus what it's marketed for.
Yes. So in Canada, it is indicated for treatment of vaginal atrophy. So when your tissues start shrinking, it's not approved in the States for that reason. And the reason, it's for aesthetical, as you said, it's used for aesthetics, not so much as for treatment of a medical condition like GSM. There seems to be good results with it. It's a potential treatment, especially for those who cannot use hormone-related products like breast cancer survivors. But the experts like NAMS and other societies would like to see more evidence of the benefits because it's promising, but we need more data.
Mm-hmm.
But it's looking good.
It's looking good for GSM.
Yes.
But this idea of vagina tightening and rejuvenation, I want to take that one and throw it out the patriarchal window.
Yes. I a long time ago when this started being talked about, somebody said, it looks like a peach now.
Yeah, so not to be confused, and
yes,
it preys on the fear of aging again.
It does.
Yeah,
it does.
Instead of focusing
on these treatments are not cheap at all. They have to be done in the doctor's office. These machines are very expensive. You're going to pay top dollar to get these treatments. Again, if nothing else works, if you're a breast cancer survivor, you tried first-line therapies and it doesn't work, you cannot take any of the estrogen-based products, this is an option for you. Hopefully, you can get coverage for it. Good luck with that too, because that's another episode. It's benefits for menopause women, but it is something you should consider because, unfortunately, I know many breast cancer survivors who haven't had sex for years. And when I explain all these things to them, they say, I tried lubricants, I tried moisturizers, nothing works. The only thing that I am left with is estrogen, and I would not touch estrogen anywhere at all. So the laser treatments may be an option.
So let's hope there's more. Are there more studies underway? I believe.
Yes, I think soon we'll have more data, sufficient data about safety and efficacy that we can use to then recommend comfortably.
Let's look forward to that publication. So if we had 3 takeaways to give the audience, what would be your big 3s for vagina health?
First of all, it's a natural thing that happens as you go through menopause and you lose your estrogen. Do not suffer in silence and in vain. There are lots of good, safe, effective options. And third, if you're not sure what to do, ask your doctor, ask a certified menopause practitioner like myself, ask your pharmacist. Do not suffer in silence.
So, Teresa, thank you so much. A lot of the information you're giving our audience hopefully encourages them to not suffer in silence. One aspect of the taboo, though, is the partner in the relationship, it is very difficult to tell your partner how you're feeling. What advice do you give your clients?
It's very difficult because most of us don't even know what we're feeling and why, right? So I did a workshop a while back and about GSM and how to deal with it and all the things we talked about. And the next day, I had a person from the audience sending me an email and saying, I asked my partner to go out for a walk and I explained to him all that I heard in your workshop. He was very glad to know. Because when I talk to women about this, I say, okay, so you don't know what's going on, but you know you're avoiding sex at all costs because it hurts, and who the heck wants sex if it hurts, right? But now put yourself in your partner's position. If all of a sudden, without any explanation, you start avoiding sex and avoiding intimacy because the cuddling on the sofa and the hugging while watching TV may lead to sex later on, so let's stop it right now and not even give it a chance. If you start distancing yourself from your partner, how she is going to feel about it? Many things could come through this person's mind. Oh, I'm not attractive anymore. She doesn't love me anymore. I'm not a good person. So we're putting our partners into a roller coaster of emotions because they don't know what's going on. So if and when, and hopefully sooner than later, you find out what's going on, just say, on a walk outside, in a drive home, whatever, I think I know why I've been avoiding sex lately. It's something that many women in menopause go through because we start losing our estrogen, and it apparently affects the tissues and affects how I feel sex. Whereas before was easy and was pleasant, now I cringe because it hurts, because I have discomfort, and that's why I've been avoiding it. It can be that simple.
I'm sure a lot of our partners would like to know that. So hopefully some partners tune into this, but not to be afraid to tell them in simple ways. It's not our fault.
No.
We're not broken.
No. And we still love them.
And we still love them. Thank you so much, Teresa. And we always like to end our segment, as you know, because I've seen you, we talked about watching the episodes. What makes you feel beautiful?
I knew you would ask that, and I've been dealing with that question in my mind, and I'm sure I have a lame answer because it was the only one for the last 8 days that I could come up with. So I'll tell you my answer after I thought about it very often, and I love many of the answers we've got from previous guests. But I really, really feel beautiful when I find myself treating others with kindness. That's when I really feel beautiful.
That's a beautiful answer. Thank you for spending time on TTOM Couch today.
My pleasure.
Today I want to talk about my secret weapon, the L'Oreal Steam Pod. It's not new, but if you haven't tried this, it is a must. It's menopause approved and teen approved. Number 1, it takes the frizz out of the hair. Number 2, it doesn't damage it. You can use it every day. If you want a little bit of extra protection, you can use the creams that are sold by various brands for heat protection. And lastly, it actually allows you to do versatile hairstyles. So you don't need other hair accessories. So you can do more of a straight, curl, wispy, lots of things you can do with the L'Oreal Steam Pod. Did I just say that again? What is wrong with me? Freaking long menopausal day. Number 2, it doesn't damage your hair. Number 3, did you know it does not?